Hi, and welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, healthcare remains, maybe other than the recession, the single most important issue in the country. We will talk about some important, maybe changes that will be taking place in healthcare, give you a little medical advice. Then Fred Anton is here. He will analyze the governor and U.S. Senate races, Pennsylvania politics and government in depth and in detail right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
All right, welcome back to the program. Well, I'll tell you, we're continuing our series on healthcare. Over the 12 years this program has been on the air, I don't think we've engaged in topics more important. Boy, do we have some great stuff for you today. Stay with us. Joining me, we have two doctors who are sitting right across me. Perhaps I will get through this segment without needing their help. Dr. Rob Cherry, he's the Associate Chief Quality Officer at the Hershey Medical Center. I got that right?
That's
Welcome,
right.
doctor. And another doctor, Dr. Reichwein. He's the Stroke Center co-director at the Hershey Medical Center. And on my right sitting here is Deborah Donovan. She's with Highmark, director of the Provider Quality Performances Management. You guys ought to be professors. We have long titles, too. Look, Deborah, let's get down to it. One of the things that there's been a huge debate in Washington about as part of the health care reform in order to save money is to move away from pay for performance and, doctors, how they get paid, all sorts of people in the medical business, profession, how they get paid. How important is that, first of all, to saving, for efficiency, for quality? Talk a little bit about that.
Sure. Pay for performance is very important in the healthcare quality agenda, primarily because what we do is align payment strategies towards compliance with evidence-based care, national improvement priorities, and again, taking a portion of payment and placing it at risk for performance. So really making sure that the care that's being provided is as we're expecting and as we're wanting, so driving towards higher quality outcomes.
Yeah. Dr. Cherry, doctors get paid in a variety of ways. Some are on staff at facilities, hospitals where they're salaried. Others that are, have their own practices get paid fee for pay for. What does that mean?
Yeah, I mean, there are a wide variety of...
Help us out here.
Yeah, there are a wide variety of ways in which physicians are paid. Some are employed by hospitals like myself, and others may work for group practices, for example, outside of facilities for a fee-for-service model. But I think regardless of the practice type, all of us are increasingly recognizing that to give the best quality of care is really what we all want. So there's a patient focus on what we do, particularly these days when we're cost-conscious about the care that we deliver. We're starting to recognize that the way to deliver the best, the most cost-effective care is really to focus on the quality of the care that we deliver.
So yeah, and we'll certainly get into that in another segment. This is, it has to be a little controversial within the medical. We love controversy, and we ought to, just lay it out there. I mean, some doctors, and I know lots of them, would say, well, I don't know about salary, I'm an entrepreneur, I'm a doctor, but I'm also a little, you're a physician. What, you have different thoughts about this?
No, I think different doctors have different ways of practicing, and many of the outcomes can be similar, but I think we're all in it to provide the best optimal patient care and outcomes, and I think as we do so and more insurance providers, etc., realize that, I think the quality will go up, and I do think physicians will probably be paid adequately for their performance.
Yeah, we're going to go to quality, but is this as am I suggesting it's not really controversial about how physicians will be paid? It seems, I mean, maybe I'm just talking to doctors, who have differing points of view on this.
I think they're all over the board. I think there are some that are probably early adopters that are already there and know that that which we don't measure we can improve, and are in it really to improve.
Yeah, we're going to go to a break, but all of you agree this is a pretty big issue for physicians. You agree,
Absolutely.
And it's one we're going to hear more about. All right, quality care. Why should you? Well, we all should care about quality care. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by The Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome to our healthcare program. Fred Anton will be on in a few minutes. We're going to talk about what else but politics on Pennsylvania Newsmakers. But we're chatting here about some, I think, some changes that are now taking place, Dr. Cherry, and are likely to be even more implemented over the course of the years. Quality care. There's not been, as much emphasis in the past as we're going to have in the future.
Well, I think a lot of us have been anticipating that there's going to be an emphasis on quality of care for the foreseeable future, and Penn State Hershey has certainly been concentrating in that area for a number of years already. Our partnership with Highmark has really been very productive. It's the way a pay-per-performance relationship should actually work. Highmark creates a portfolio of projects, quality projects that we can select from, and over the last several years we've selected projects that have been very helpful in reducing complications and improving outcomes for our patients. We've been very successful at reducing selected hospital-acquired infections, for example.
Well, that was a huge issue a few years. Don't hear much about that anymore. Is that because it's been contained, or, boy, there was a 3 or 4 years ago, we did a fair amount of programming on that.
And I think, yes, as projects come and go and we get very good at enhancing quality, there's plenty of other areas within the healthcare system that need improvement. And the same at our institution. We are shifting gears via Highmark and other corporations to focus on things that probably need more work and defocusing on things that are well into good high quality.
Let me see if I can understand this. I mean, are we saying here that you're going to pay for there'll be differential pay depending on the quality of the care, or that you will set standards that you expect across an array of practitioners, whether it be physicians and nurses and technical folks, that they're all going to have to adhere to these certain quality standards? I mean, if just one element is doing it, you have to have an integrated...
Correct.
Explain that.
It has to be that the hospitals have to form teams that actually will work on these particular indicators. And so, for example, on working on reducing healthcare-associated infections, which is still a large problem in the nation, but we've really put a lot of focus in our Highmark Quality Blue program on hospital-acquired infections, and we've seen great work from our hospitals that are working on it, but it does require everybody working together to get it done.
A more integrated approach. I don't want to take you back to your medical school days. Maybe you don't remember, you remember those days. But there probably was not a lot of emphasis on that in medical school 20 or 30 years ago. Is that going to be something that I think doctors are going to have, in the course of their training?
Oh, absolutely. I mean, there was no real focus on patient safety and quality when I was in medical school. It's very interesting because now we've actually developed an interprofessional curriculum for our medical school. We've just unveiled it over the last couple of months, where nursing students and medical students are together collaborating and learning about patient safety and quality. So we're starting to train a younger generation to think this way.
Yeah, because it really is not just one. I mean, we all, go to our, 85% of the people access health care through a physician.
Correct.
We've done a lot of research on that. But it is really important that everyone in the entire healthcare system, from entrance into the system to, leaving the door with, here's what you need to do for therapy or whatever, all be on the same page.
Correct. And I think that has historically been the problem. Patients and families assume that if they go to see a doctor or a part of the system, that they get the same kind of care and the same kind of treatment, but that isn't the case. Some doctors are better than other doctors, and some systems are better than other systems. So if we can improve upon that, number one, the outcome should be better. There should be less future complications, and hopefully it should be cheaper and more cost effective.
All right, we're going to go to a break. Dr. Reichwein is in the house. He's going to be our physician for the day. We're going to talk a little bit about stroke. The program doesn't have a medical. Maybe we ought to have one. You ought to come in here and give us some. All the networks and cable, they all have their own doctors. All right, we'll be back. You want to stay here. How common is strokes? You don't want to miss this. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hey, welcome back to the program. All right, we're going to get some medical advice here. Dr. Reichwein, first of all, tell the folks your specialty.
I am a stroke neurologist.
All right.
And strokes are sudden brain injury that are caused by blood vessel blockages or injury.
How common are they? Too common, I know.
There's approximately 1 million events per year when you take mini strokes and put them together. 3/4 are strokes. When one has, as far as what a stroke is, a stroke will cause sudden change in function as far as speech, language, vision. Most strokes have weakness as part of them, and it's the type of thing that will dramatically change your life in seconds.
And I think almost everyone has had someone in their family,
Correct.
either their immediate, their
Correct.
Or extended family, and we've all seen the horrendous physical results of that. Now, there are lots of different newer methods for kind of seeing if you're predisposed may not be the right word. Is that the right word?
Correct.
Towards a stroke. Talk about that.
There are various risk assessments that exist out there, and every individual, more so as one gets older, 50s, 60s, should go through an assessment in part via their primary care provider to screen for stroke and heart attack risk. There are various community health screening services that exist, and as part of them, some have vascular screening.
And I'm doing one of them. I'm doing one of them. I still will be back next week.
To screen the carotid arteries in your neck, which can cause a stroke. Look for other parts of vascular disease in your body, particularly the aorta.
How often what age, is there an age that you should say maybe this is a good thing to do, one of these diagnostic tests?
Well, probably everyone, even at a young age, should see their doctor. It's not uncommon to have high blood pressure, diabetes, high cholesterol, even at an earlier age, and definitely as you get into your midlife, 40s and 50s, probably at least on an annual basis, one should go through screening. And as far as strokes are concerned, 4 out of 5 strokes are preventable.
Wow.
So if you
hear that, 4 or 5.
4 out of 5 are preventable.
Quality care, is there a relationship between what?
Oh, there's absolutely a relationship because it's all about the timeliness of care. The quicker that you can recognize your symptoms and get to a stroke center quickly, the better your outcome might be. And so we've developed a brain attack team within our emergency departments. It's an interdisciplinary team that if someone is presenting with signs and symptoms of a stroke, there's a team that consists of emergency medicine physician, neurology team, radiologists, and nursing that collaborate in an interdisciplinary way in order to get the care promptly for that patient.
And insurance coverage works for all of this? I mean, this is not...
Sure.
Go ahead.
It certainly does work, but more importantly, stroke is one of the program indicators that we used for Quality Blue because of the impact that we saw across, 4 out of 5 was a significant impact to our members as well as the population as a whole. So definitely a big issue. And
Great having you all in here. All right, Fred Anton is up. What else? Pennsylvania Newsmakers, the governor's race, the U.S. Senate race. It wouldn't be one of our shows without it. Stay with us. We'll be back after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. and by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. Well, we're back to politics, and when we talk about politics, one of the guys who comes in probably knows as much about politics in this state as anybody. He's sitting across from me. He's Fred Anton. He's the chairman of the Pennsylvania Manufacturers Association. All right, Fred, let's get right to it. In the big news in the governor's race within the last couple of weeks, Jim Gerlach, a congressman, gets out, leaving, of course, Tom Corbett, the attorney general, as the favorite, but Sam Rohr, a House member, more conservative, is sort of nipping at his heels. Give us your quick assessment of the governor's race, Republican primary.
Well, of course, Tom Corbett is the front runner, and he's the front runner by a wide margin.
Yep.
And by that I mean he has the support, I would say, of 90% of the political players in Pennsylvania. I think what happened over the last weekend at the Central Caucus, where both Tom Corbett and Sam Rohr, who is a legislator from Reading, where they both appeared, and where Corbett got the overwhelming number of votes, something in the area of 120 to maybe 20 for Sam Rohr, probably indicates where the political establishment has lined up. Yeah. Now, this Tea Party movement and the conservative grassroots movement, which is causing, getting a lot of attention nationally in Pennsylvania, it's hard for me to assess the strength of that movement.
But they'll probably be with Representative Rohr, right, who's more of a property tax, small government advocate. Yes or no on that one?
Yes, they will be.
Yep.
And it's also very, very difficult for me to judge the number of independent voters, both independents within the Republican Party and the Democratic Party. As you know, the registration is very overwhelmingly Democratic in Pennsylvania, but many of those are soft party people who make up their own mind.
So go ahead, finish your thought.
In major races.
Now let's go to another aspect of this. I mean, Tom Corbett is the favorite. I mean, I think everybody would agree, and Rohr is kind of running a rearguard action, maybe gets the Tea Party and more conservative elements active. But let me ask you this question. The trial of these bonus gate folks are underway. You know, Mike Vion, former whip in the party, #2 guy in the Democratic caucus, on trial. Is Corbett's candidacy for governor dependent on him convicting some of these high-profile bonus gate, public corruption, you know, the charges they have against? What happens if he would lose one or more of those big?
It would hurt his candidacy terribly.
Yep.
His candidacy is very, very tied to these bonus gate prosecutions. Now, as you well know, the first of the bonus gate prosecutions, Sean Romali, there was a verdict for the defendant. These bonus gate prosecutions are not open and shut by any means. People should not be confused because a number of those who have been charged have pleaded guilty and decided to cooperate in the prosecution of others.
But now, can't Tom Corbett simply say, it's true, but I've got 7 convictions already? I mean, is that a legitimate argument that he can make?
He can make that argument, but I think that there are lots of reasons I can say to you, and I would if I were running against Tom Corbett, there are lots of reasons why those guilty pleas are not unqualifiedly admissions of guilt. I know from some difficulties I've had in a quasi-criminal case, there are reasons, many reasons, why you might plead guilty.
Yeah, you could get convicted even if you're innocent.
Well, and also you may not be able to pay the cost of your lawyers.
Oh, that's a good point. That's a good point. And a lot of these people that work for the legislature aren't wealthy people.
And these costs of lawyers' fees, they're not reimbursable, Terry.
That's why we have you on this show, to bring these insights. Now, look, we got to move ahead. I want to. Look, you know Senator Specter. He was a Republican for virtually his entire career. Tough primary fight with Joe Sestak. Specter leads in the polls. His numbers on job performance are not very good. Wow, what an unsettled. Sestak is running all over the state like Arlen had done in the past. Specter's back now, campaigning pretty hard. Give us your quick assessment of that race.
Well, what are the factors that are critical? The amount of money you can raise, your organization, and your name identification. Now, Arlen Specter has 80 or 90% name identification. Whether a voter likes him or whether a voter hates him, he has a high name identification. Right. And also, he's got a varied record, but he's done many positive things. Now, I'm an establisher.
It's the experience plus what he's delivered.
Experience plus what he's delivered. And also, he in many cases, doesn't get credit for many of the things that he's done that have been good for Pennsylvania. Our federal judiciary, almost all of the judges have been recommended.
So he's going to run on the experience. Now, we have about a minute left. Tell me about Sestak. Sestak running a populist, go ahead.
Sestak is a admiral, I believe a 3-star admiral. He's 58 years of age. He beat a long-term Republican congressman in Delaware County. He's well known and liked in Delaware County. He would be reelected. He's known in the Philadelphia suburbs where there are a lot of voters. Of course, Specter is well known in Philadelphia.
But Sestak's very liberal. I mean, not arguably. He's
liberal. His biggest hurdle is name identification.
And money. He's still going after. He's got, what, maybe $4 million or something?
He doesn't have nearly the amount of money. And I happen to know Arlen Specter is raising a tremendous amount of money. Now,
so we got to go. We got to go, but is this competitive?
This is competitive, and Sestak wants 6 debates. Specter wants to give him 1.
Yeah. Got to go, but it's competitive, tough, and anything can happen. All right, we'll be back next week for another edition of Pennsylvania Newsmakers, and as always, stay well.